Approaching the patient with back pain. The factors that determine the degree of back pain and especially the amount of disability associated with the pain are therefore the result of multiple factors. Structural pathology sets the stage and is the origin of the painful stimulus. Beneficial influences and harmful influences which impact on the outcome of treatment of back pain. Harmful influences, beneficial influences, fear, listening and caring, anxiety, laughter, anger, explanation, uncertainty, encouragement, boredom, attention, history, prayer. The natural healing process in most situations results in the resolution of back pain within a relatively short period. Physical stress placed on the back through work and leisure activities may slow the healing process or irritate spinal pathology such as degenerative changes and disc protrusion. It's, however, the psychosocial situation of the patient that determines the level of discomfort and the response of the patient to the painful stimulus. The patient's psychological state, level of satisfaction with work and personal life, as well as his or her social and spiritual life, may impact upon the central modulation system in the brain and modifying the response to pain. A great deal of emphasis is placed on visualization of spinal lesion that can result in spinal pain. To rely on anatomical changes to determine the cause of back pain can, however, be very misleading speculation through the mechanisms described above. There are other examples in science that can be used as model for looking at spinal pain. The Danish pioneer of quantum physics, Niels Bohr, claimed that science doesn't adequately explain the way the world is, but rather only the way we as observers interact with this world. Early in the last century, it was discovered that light could be explained in terms of either waves or particles, depending on the type of experiment that was set up by the observer. Bohr postulated that it was the interaction between the scientist as the observer and the phenomenon being studied, in this case light, that was important. The same thing can be said for model for spinal disability. This model is one manner of visualization the interaction of spinal pathology, work, requirement, and psychosocial factor in the genesis, the back pain and its resulting disability. Back pain and disability, psychosocial environment, work, requirements, spine pathology. The same thing can be said for the model of spinal disability. This model is one of manner of visualizing the interaction of spine pathology, work requirement, and the psychosocial factor in the genesis of back pain and its resulting disability. Back pain and disability, psychosocial environment, work requirement, spine pathology. The clinician approach a patient with back pain. Conclusion reached by the clinician regarding the etiology of back pain in the specific case are often depend on the interaction between the patient and the clinician and the training and experience through to the decision-making process by both individuals. There are other ways of looking at back pain. Postulate that there is a delicate balance between disorder and order. The origin of the universe is generally explained by Big Bang theory this which states that in the beginning there was total disorder, which was followed by a gradual imposition of order through the creation of galaxies, stars, and planets. This process was perceived as occurring through a delicate balance between the forces of gravity and the effect of the initial explosion. This process emphasizes that small changes at the beginning of process or reaction can result in large changes over time. If one applies this analogy to the interaction between patients with back pain and their physicians, the outcome of treatment can be perceived as being impacted upon by a number of beneficial influences, a little nudges and harmful attitude or little rebels, the patient's symptoms can be positively impacted through such process as listening, caring, laughter, explanation, encouragement, attention to detail, and even prayer, and negatively impacted by fear and anxiety, anger, uncertainty, boredom, and haste. The most accurate diagnosis possible is dependent on accurately observing and listening to the patient, the physical examination, and the result of all testing in combination with the intuition that gained by experience from treating multiple smart patients. The fine balance between different factors impacting on back pain can be illustrated by few examples. A 50-year-old woman presented to her doctor with symptoms and signs of disc herniation confirmed by CT scan. She was the owner of a small cattle range and was worried about the condition of her animal. She underwent surgery to correct the disc herniation, but her convalescence was prolonged for no apparent reason. After several months, the condition of her cattle herd improved, and at the same time, the patient's symptoms improved. 3. The question as to link between patient symptoms, disc herniation, and the condition of her cattle. Sample number 2, a 45-year-old gentleman in a position with a responsible insurance company represented to his doctor symptoms and signs of severe L4-5 instability confirmed by stress X-ray. The patient underwent a post-torlator fusion. At 3 months, the fusion was solid, but the patient's symptoms didn't improve. Further questioning revealed that he felt stressed and was unhappy in his work. At 6 months, he became symptom-free without further treatment. The only evidence change in the status was the resolution of his difficulties at work. A 35-year-old gentleman with a wife and 2 small children was admitted to the hospital on an emergency basis with suspected Coda equina syndrome. A psychotherapist assigned to the case discovered that the patient found the presence of his mother-in-law intolerable. Arrangements were made for the mother-in-law to live elsewhere, and the patient made an eventful recovery without the necessity of surgery. The approach of patient and the experience of the clinician or the teamwork dealing with the patient is very important to look at different things, the psychology of the patient, the pathology, the physiology, taking history, and also the test of MRI or X-ray or CT scan, relate everything and make a good decision. Thank you.